All right, good morning, everyone. Thank you for joining us today, and we're especially honored to have this distinguished group of officials behind us. I want to thank Governor Lamont, Senator Blumenthal, President and CEO of Stamford Health, Kathy Szilard, as well as Dr. Shah, our esteemed delegation, Senator Pat Miller, Senator Wong, our honorary member with us today.
From the Public Health Committee.
From the Public Health Committee, that's right. Representative Blumenthal, as well as Representative Corey Paris. Thank you for being here today, and thank you to this courageous group of leaders for all of your efforts the past 2 years battling this pandemic. Connecticut is one of the best positioned states on COVID, thanks to the courageous leadership of people like Governor Lamont, Senator Blumenthal, our state delegation, and our incredible health and safety partners. As Mayor of Stamford, I want to welcome you all, and I want to express my deep gratitude to Stamford Hospital in particular, and all of our frontline healthcare workers, our nurses, our doctors who have been battling this pandemic for over 2 years now. And what a better place we are today. Even though we're seeing a spike in cases, we are so much better off than we were 2 years ago, thanks to the leadership of Stamford Health, thanks to our population in Stamford. Thank you to everyone who's been doing your part, wearing your mask, getting vaccinated, getting boosted. While we have seen a spike in cases, the acuity has been much less severe because of all of your collective efforts. So on behalf of the city, I just want to say thank you to the tremendous collaboration between our health and safety partners, the people of Stamford, and everyone who's worked so hard to battle this pandemic. Just to brag a little bit about Stamford, we are one of the most vaccinated cities in the state. We're the second most vaccinated city after West Hartford. 97% of our population has initiated a vaccination. We know that is the best way to protect yourself and your family and the public from stopping the spread of COVID-19. In fact, 75% of the hospitalizations we're seeing are individuals who are unvaccinated. So we're still encouraging everyone, if you can, please get out there, get vaccinated, get your booster. Also, thank you for bearing with us with our mask mandate. We know that this is not the way we wanted to head into 2022, but this is the best way to stop the spread when we're indoors, and we thank the public for their cooperation and know that there's going to be light at the end of the tunnel soon, so thank you for wearing your mask. Finally, I just want to thank the incredible effort yesterday where we distributed 20,000 at-home tests to Stamford residents. It was an efficient and smooth operation. I want to thank the governor for his leadership in helping us get these tests. Thank the delegation and Senator Blumenthal for all their work at the state and federal level. This is critical to helping those who are high risk and most vulnerable, and really proud of the effort that was completed yesterday. And so finally, I'll just say, as mayor, our goal is to stop the spread, to protect those who are high risk and most vulnerable, and to hopefully get some light at the end of the tunnel in the coming months. And I'm optimistic that 2022 is going to be a much better year, thanks to all of you. So with that, I want to turn it over to Kathy Szilard, our CEO of Stamford Health.
Thank you, Caroline. And I also want to introduce DPH Commissioner Dr. Juthani, who's joining us today. So I really appreciate all of you being here. As a large not-for-profit healthcare system that serves Lower Fairfield County and parts of Westchester County, I want to tell you that we've been taking care of COVID patients for a long time now. We've taken care of almost 2,000 inpatients. We have actually vaccinated, you heard those great statistics from our mayor, 89,000 individuals were vaccinated here at Stamford Health during the post-pandemic period. And we have performed 243,000 COVID tests. The steps that the state of Connecticut, Governor Lamont, the DPH Commissioner Dr. Juthani, Senator Blumenthal, and Mayor Simmons here in Stamford have taken to expand access to testing is so very important, because without testing, we don't know what the positivity rate, and we don't know what we're up against in terms of this wave of the pandemic. Last week, Stamford Health administered 4,200 tests, and the positivity rate was 40%. And that's up from 26% the previous week and 13% the week before that. So what we are seeing is that there is a great deal of prevalence of COVID-19 in our community. What the scientists tell me, however, that remember in the history of viruses over time become far more contagious and far less virulent. And that is what we are hoping with this virus, that we're seeing more, but that it's going to impact us a little less. Nevertheless, we're not there yet. Today we have 68 inpatients here at Stamford Health who are in our beautiful facility right now. We have 7 in the ICU, and I have to tell you, just as you heard from our mayor, 75% of those that are getting most sick that are in the ICU right now, almost 100% of those that are in the ICU are unvaccinated, and 75% of our inpatients actually who have gotten sick have been unvaccinated historically. Clearly, in light of these increasing cases, we need to buckle down and take precautions. I do want to assure you, however, because we have this brand new beautiful facility with all private rooms, we've been able to continue to do all the things we do every day. We deliver babies, we take care of patients with trauma and cancer and heart attacks and strokes and elective surgery. That does not stop. And so we have to continue to do that simultaneously, and it is because of our amazing teams of clinicians that we're able to do that really well in our community. In addition, we're always looking at expanding our capabilities in terms of vaccination, and we had a mass vaccination site here and at Elmcroft, and we're looking to expand our capabilities even currently now that we know how important that booster is. So people ask me all the time, what do I do to stay safe? Well, it's pretty easy if you follow the rules. You have to follow the 4 W's. As Mayor Simmons said, no one wants to wear the mask, but guess what? It really, really works. And so we have to wear the mask, wash our hands, watch our distance, and make sure that we're continuing to wash down surfaces. And most importantly, we have to get the vaccine. And if you haven't gotten the vaccine yet, please do so. And if you haven't gotten the booster, please make an appointment to get the booster. Earlier, during the COVID-19 spikes, when vaccinations were not yet available, we saw much higher death rates. So to put it very simply, the vaccine prevents us from seeing people die from COVID-19. And so it is so very important. So we had a wonderful distribution of tests yesterday to our community at-home tests. And I wanted to share a little bit about what our experts say about when those tests should be used. So the infectious disease leadership here at Stamford Health, and Dr. Shaw is here on my right, recommends that the tests at home should not be broken open the moment someone gets home with them. If you believe that you have had a significant exposure, or if you are symptomatic, then you should test. If you've only had an exposure, you should actually wait 5 days from the time that you had the exposure to test so that you will get an accurate test results. You don't need to use the kit the moment that you get it, and actually it's a good safety net for households to have when and if something happens or something changes in your household. If you test positive and you have no symptoms or mild symptoms, you can likely recover at home. That is the good news about this new variant, is that most people have mild disease. And so if you're fully vaccinated, and especially if you're fully vaccinated and you had a booster, most likely you will have mild disease and you can recover at home. Please call your physician, however, if you have any questions, or reach out to someone on the Stamford Health staff or through our website, and we'll be happy to help you. We also have something called Stamford Health On Call Care, which is our virtual platform to have a telehealth visit if you can't get to the doctor. If you're staying home and recovering from COVID-19, please protect your loved ones. Wear the mask. Make sure that you're distancing so that you don't spread the disease within your own household, especially if someone in your household is immunocompromised or unvaccinated. If you have serious types of symptoms, such as difficulty breathing, etc., please make sure that you contact your healthcare provider, and if you need to, please come to the hospital. As of December 27th, the general population isolation guidelines have changed, and this is promulgated by the CDC. After a positive test, regardless of vaccination status, someone can come out of isolation after a minimum of 5 days at home after a positive test, but they must be free of symptoms and free of fever or having resolving symptoms before they return to either their work environment or socializing or associating with other individuals. So in closing, I want to thank the governor, senator, commissioner, and mayor for all they're doing to help us weather this latest wave of COVID-19. Although it may be disheartening to experience the Omicron wave, as the President and CEO of this region's largest healthcare system, I want to assure you that it is safe to come here and it's safe to continue to receive your care, your routine care. We were very concerned with the pandemic previously that people postpone routine care, and we know that that can have negative results, and we do not want to see that happen again. I've also been so heartened by this outpouring of support from our community for our Stamford Health. It makes a big difference to our healthcare workers to see the support that all of you have provided to us in this community. So thank you for everything you're doing to keep yourselves and your loved ones safe. And now I'd like to welcome Department of Public Health Commissioner Dr. Juthani. Thank you.
Thank you for that introduction. It's a pleasure to be here today. I want to remind people where we are in this pandemic. We've come extremely far thanks to the commitment of this administration and the people of Connecticut who have gotten out and gotten vaccinated. And because of that, we are in a better place than we were a year ago. I know people are scared and are concerned with hearing about a new variant yet again. The good news is if you are vaccinated, and particularly if you are boosted, the majority of people are having mild symptoms, some are even asymptomatic. As you heard about what happens with viruses as they adapt over time, they do become more infectious and less virulent. But for the unvaccinated, this is still a very serious disease. As you have heard, throughout our state, 70 to 80% of people who are in the hospital are unvaccinated. The unvaccinated have reason to be scared. For people who are vaccinated, we are looking at a better future. If you have not gotten boosted yet, I can tell you that people who have not been boosted are having more symptomatic disease. People who have been boosted are having much less symptoms. So please go out and get your booster. It's good for you, your family, and for preventing more spread in our community. One thing I want to be clear to everybody: if you do not feel well, stay home, regardless. It is important to get a sense of where the disease is in our community, but we do not need people who don't feel well out there spreading either COVID or any other respiratory virus, which we have others as well in our community right now. You've heard the guidelines of how to use these self-tests, and I cannot be more proud of all the people in this administration that helped allow for this distribution of masks and tests over the last week. These tests are really a screening tool for those who are symptomatic or, as was described, if you've had an exposure. That's the primary reason that we want to be able to use these tests, especially with the number of people that are looking for tests at this time. So I want to just reassure people that we will get through this, but we have to work together to be able to care for each other, optimize the use of these tests that we have in our community, and we will get through this wave just like we have the others before. And thank you to all that's happening here in Stamford to be able to show us how we can do this well. And I'd like to now turn this over to Senator Blumenthal.
Thanks, Doctor. Let me just begin by thanking Stamford Hospital, my hometown hospital. 36 years ago, I came here, not to this building because it didn't exist, but to the one down the way for the birth of my first son, Matthew. You know, dads don't get to embarrass their sons all that often, so I'm going to take full advantage of it. But it brings home the point. Stamford Hospital is a community hospital. It serves the community. I've come here in the last year for checkups. The people of Stamford really love this hospital. They appreciate it. People from all over the area support it. And our hospitals in Connecticut have been through a really rough time because they've been challenged fiscally, and the federal government has tried to step up. I don't know how many times I've talked to Kathy. The entire delegation has worked hard for our hospitals. The fiscal challenges have been enormous, and Stamford Hospital's leadership has done so extraordinarily well in meeting those challenges. Thank you to you for all you've done, and thanks to the great docs, nurses, staff, Dr. Shah. You're here as a representative of them, but I know folks who work here in every part of the hospital, and they are just so dedicated. Nobody should underestimate the hardship and heartbreak that they have been through over this last year. It has been gut-wrenching, really mind-boggling to see the kind of emotional challenge that they have had to weather. And my heart goes out to them, as it does to all of the first responders who have been on the job, doing their work day in, day out, and now many of them are afflicted with this virus. I don't know how many are out right now. 140 professionals from Stamford Hospital are out because of COVID. 80 up at Middlesex Hospital are out. Tens and hundreds of others, healthcare workers, are themselves afflicted with this disease because they've shown up for work, they've done their job. So in very tangible and real ways, they have sacrificed. I want to emphasize on this point of testing. Some of you have heard me say it before. The governor really deserves a lot of credit for stepping forward, aggressively seeking more tests, and his tremendously important efforts need to be matched by the federal government. The president has started 500 million tests, take-home, at-home tests are an important start. But we need billions, not the 500 million, literally 2, 3, 4 billion of these tests. And people really appreciate them. I was around the state yesterday in Trumbull, Waterbury, Naugatuck, and Fairfield. I stood in Fairfield giving out tests. People were so happy. They are so thankful. They want these tests. The demand for these tests is skyrocketing because they know it is the way to get back to school, get back to work, get back to normal. People who know they are infected can stay home. And if they're fine, they can go back to school, go back to work, go back to normal. Testing is key. And the testing that's done right here at Stamford Hospital, I've come here, I don't know how many times on my way back to Washington, is really first rate. It's easy. I went by. The line is not that long this morning. Testing here is great. It's a great opportunity. People should take advantage of it. So Connecticut is really stepping up. The federal government has to step up as well. In the CARES Act, there was a requirement that these tests be stockpiled. It was never done, which is part of the reason why we're facing this deficiency now. We need now to stockpile for the next emergency, not just to meet the present needs, to avoid lurching from emergency to emergency, a real stable and reliable supply for these tests. So I'm hoping that as I go back to Washington literally today, we will take action, emergency action, to make sure that these tests are available throughout Connecticut and throughout the country, because it is key to addressing this COVID continuing plague. And Dr. Jithani is right. We're going to get through it because of Connecticut coming together, as we always do, and the really brave and important professionals that we have on the job every day. And with that, I think, could you give Senator Wong? Senator Wong?
Good. Thank you. Thank you. Thank you for all your patience in being here. I want to begin by acknowledging our frontline healthcare workers. They do incredible work in protecting us, but they're also exhausted, and they deserve all of our support and acknowledgement. I am here as a member of the Public Health Leadership Committee to acknowledge that it is extremely important for all of us to work together. I think it's important, and I want to acknowledge the efforts that we made to address testing and the increased capacity that's needed. I am here to offer my support to the governor and to the legislative branch that we need to increase capacity for testing. Whether it's at home or increased testing centers, it is absolutely essential for us to ramp up capacity, because it's not only from a standpoint of addressing this issue of the COVID pandemic and the Omicron, but it is also important for the safety of our workers. And secondly, and critically, as we begin the new school year, we need to ensure that testing is in place so our teachers are safe, that our students are able to go in school, and that we can continue that measure of beating this disease. So it's incredibly important that I'm here to support every effort to increase capacity of testing centers and at-home kits, but also importantly to address that people get vaccinated. You get boosted, you protect yourself and your loved ones. So for me, as a Republican, as a member of the Public Health Legislative Branch, we're here to work with the administration to address the issue of increasing capacity, increasing access for our residents in this state so that they can continue to move forward and that we don't suffer the standstill that struck us nearly a year and a half ago. The economic impact will still be felt. We can't afford to go backwards. So I'm here to offer my support and acknowledge the governor's leadership on this, but also offer the legislative branch's input and participation in crafting the best policy for us to protect all of our residents in the state. But it's equally important, I want to address that we need to get our kids back into school. So thank you very much.
I've been asked to introduce Pat Billy Miller.
I feel important, introduced by the governor. So, good morning, everyone. First of all, I want to say thank you to Stamford Health Center, so health system. You know, when I think about the men and women that have put their lives on the line so that we could stay safe, I say thank you. To those of you that are unvaccinated, I implore you, please get vaccinated. Is it fair to put these men and women who have taken an oath to keep you safe, to put their lives on the line to keep for you, to make sure that you're able to walk out of the hospital? Is it fair to them where they're overworked and they're putting their families in jeopardy to keep you safe? So the mayor said we're 97% vaccinated. The other 3%, let's make that 100%. I'm also here to advocate for more testing sites. I know you've done a stellar job in making sure the individuals get appointments, but how long does it take to get an appointment? You know, so it's very, very important to make sure, Senator, this is the federal government stepping up. The federal government stepping up to make Stamford Hospital a testing site. Also, I want to thank the Stamford Community Health Center for stepping up. So I want to say to your workers, Kathy, and your team, thank you so very, very much. To the people of this state, I know these are difficult times, and I know they're scary times, but we have to do what we can do to stay safe, and especially our children, making sure that they're kept safe. And so, Governor, I want to thank you for making sure that the schools get these self-testing sites. That's very, very important. And yes, it is important that our kids are in the classrooms, and that's my goal, but not at the cost of them catching COVID and not being safe. So again, I want to say thank you to the healthcare workers. I can't thank you enough, because I'll be honest with you, I don't know if I would be able to do what you do. So it takes a commitment and a love for the people to do what you do. So thank you for keeping us safe. God bless you all.
Maybe I'll step in now, and Corey and Matt, and we're here with the legislature. We're going to speak with one voice, because we're much stronger when we speak with one voice. Kathy, when you said 40%, and Manisha and I, the numbers that we show statewide, still a little over 20%. But what you got to know is there's rampant community spread. And you're going, oh my God, I've been through this before. I don't have the energy to do it again. This is not 2020, and this is not 2021. We're in a very different position than we were before. We have all the tools to keep you safe. More importantly, you have all the tools to keep yourself safe. And that's how we keep our schools open and our businesses running. And that's how we are able to continue to live our lives during what I think is the final stages of COVID. First of all, as you've heard, we have plenty of vaccine. No excuse if you're not boosted right now. Stanford, aren't you getting a little edgy? I mean, you get like West Hartford beat you out as the #1? Let's go. You can do it. And it works. And it keeps you safe. And it keeps you out of the ICU. And what a difference that makes. And number 2, we have millions of these N95 masks that we are getting distributed that make an enormous difference. I'll describe what they mean to you right now. And finally, I know the urgency to get the rapid tests and the PCR test. We've got over 1 million have come through our warehouse over the last few days. We got 20,000 distributed to Stamford this weekend. I think another 20,000 will be going directly to the schools over the next few days to make a difference there. We are getting these out to every municipality in the state. And there's more where that follows. We're working that pipeline. I'd like to think that the supply chain is beginning to slowly unclog. And this is a bridge until Dick Blumenthal and Joe Biden get those 500 million that are coming, I think, by the end of this month. But let me just give you some advice, because this follows on what Kathy said. We can't have everybody rush the gate for the tests at the exact same time. I just urge a little bit of common sense here. I can't mandate common sense. But if you were symptomatic, if you've got some cold, flu-like symptoms, you probably have COVID. And you definitely should stay at home. And you definitely should wait until those symptoms subside. And then get yourself that test and make sure that when you get back to work in 5 or 6 days, you're ready to get back to work and you're ready to get back to work safely. If you test positive, don't go rushing to the emergency room. There's no need to overwhelm our hospitals. Go home, spend a few days, quarantine, and then get tested again and make sure you can get back to work. And by the way, maybe you get back to work in 5 days. The second half of that, another 5 days, wear the mask. Wear the mask. These are all ways that if you use common sense, we've got the capacity we need to get folks tested as needed. Okay, who shouldn't rush? Young, healthy folks, boosted folks, folks who are telecommuting and don't have to be on the very front lines going forward. Wait a few days. Give a little time so we can get the testing through the pipeline. We have a lot more testing coming through, and we'll be able to take care of you as needed. But this is how we're getting through this. I look down at New York. I compare notes a lot. They have an infection per 100,000 that's about double what we are. New Jersey has an infection per 100,000 that's about double where we are. And that's incredibly, it's no source of false pride for Connecticut because we're a little more vaccinated. It also gives you an idea of what could be coming if we're not careful. The inverse of that, though, is you see South Africa, you see how fast Omicron went up and back down, getting back to a new normal. We see some early indications of that out of London as well. So I really believe that we can fight our way through this. We can do it safely. I'm really pleased that the overwhelming majority of our schools are opened. I worry a little bit about, people at this point. Usually it's hospitalizations, in particular ICU, that I'm focused on right now, because that's where you maybe have capacity. I used to downplay infections, except in this one instance. I care deeply about making sure people can get back to work. So we have bus drivers for our schools, we have nurses for our hospitals, we have teachers who can get into the classroom, and that's what we're trying to manage right now. But we have the tools to manage our way through this, and that's why I wanted to do this event today with all our incredible partners here standing shoulder to shoulder. Thank you.
Sure.
Could you give us some concrete measures as to what the staffing looks like right now? How many openings, how many people have you lost, how many travelers have you had to bring on board?
Sure. We have 3,700 employees, so even though it's definitely challenging, if you have 140 out, fortunately they have low-level illness and they're coming back to work very quickly, and we have been able to augment our staffing with travelers, with per diem staff. We have a whole arsenal of people who can work part-time and pitch in to be able to fill the gaps whenever we have employees out. And those 140 are across the system. It's not just direct caregivers. It could be a biller or a registrar or someone who's working in the back office. So we are very fortunate in that we've had low-level illness. We've been able to replace those individuals either through our existing workforce helping out extra or through per diem and traveler staff. So that's how we've managed.
Give us some COVID numbers, but what's your overall capacity look like right now?
We have 305 beds. I think our census was about 240 this morning. So we have capacity.
Governor, you seem to be sending sort of two messages. One, get tested, but, well, because there's not a lot of tests, don't test unless, are we ever going to have enough tests? I mean, here we are almost 2 years into this, and we still haven't gotten tested.
Look, we have 3.5 million people. If all 3.5 million want to get tested every day because they're really worried, we're going to have choke points. We have a lot of testing now. Like I said, 1 million. We have 500,000 going out to our schools over the next few days, making sure that we can test folks on the front line, making sure we can test folks who want to get back to work, making sure we can test folks who are the most vulnerable so that Kathy continues to have capacity in her schools. Paul, over the next week or two, as the supply chain opens up, I think we'll have even more testing, so then the worried well can move closer to the front of the line and get tested. So my message is pretty clear. I'm not saying everybody run to the gate and get tested tomorrow. I'm saying we have enough testing to take care of those folks most vulnerable, most in need, and give us a little time, we'll have enough testing for everybody.
What is the status of the vaccine or testing mandate that was suspended? I believe only for 2 weeks. For state employees and school folks, you got to either.
Yeah, Manisha, do you want to take that?
Sure.
So for specifically state employees and teachers, what we have allowed is that the self-test can take the place of the PCR test, specifically related to those who are unvaccinated who might be coming back to work. So that is what's in place right now to be able to relieve some of that pressure on people who are needing tests because of the pressure both on PCR testing and for self-tests. Also, in addition, our school guidance has changed where we allow for self-tests in addition, not just PCR tests.
These tests aren't gonna, they're gonna say that you've got the virus. They're not gonna say, well, you're not gonna know whether you had Delta or whether you got Omicron, anything of that.
Right. Yeah. So first of all, in general, when you do a PCR test, in terms of our laboratory partners across the state, about 25% of PCR tests are sequenced to know whether it's Delta or Omicron, and that is not going to go to the individual patient. It gives us a sense of the different types of variants that are circulating across our state. And so we get a sense of where things are moving. This is how we saw Delta take over in terms of the entire state, and how Omicron is continuing to rise, and I predict will be the entire state very soon. So PCR tests are able to give us that information. Self-tests, because they are, one, not reported, and secondly, we don't perform that kind of sequencing, they do not serve that purpose. However, they serve a very important purpose of people keeping and staying home when they realize they're infected.
I think last Thursday's extended report, was it about 22%?
Yes.
The tests came back wrong.
That's correct. So we will have more information this week when we get all our results from various different lab partners. What I can tell you is that in our state lab, Omicron was identified in all of our counties throughout our state. So it may be in different proportions. I would suspect that Fairfield County has the majority, but it is everywhere in the state and will continue to move in that direction.
Doctor, the reportable tests, roughly what's the breakdown between PCRs and rapid?
So to be clear, rapid tests are not reported to DPH at all.
Oh, really?
Yes, so
Even if you're at a clinic?
No, so in a clinic, if it's an antigen test in a clinic, that is different than a self-test that is done at
I'm
home.
not asking about self.
Okay.
I'm talking about people who go to a walk-in or some other facility and get a rapid test versus a PCR. Just roughly what's the breakdown of that's what I mean, the reportable test?
Between the antigen tests and the PCR tests. I don't, unfortunately, think I have that number top of head.
You have time for one more question?
When do you think you'll start to see hospitalization and
Well, I'm very concerned. I'm very concerned about our hospital staff. I'm concerned about nurses and doctors that have been working on the front lines. As we've heard what's happening in New York and New Jersey, we've seen throughout this pandemic that generally what happens there eventually makes its way to us, which is why we really need people to do the things they know they can do right now. And those mitigation measures of wearing your mask, staying home as much as possible. If you are able to telework, I think that's a good thing to do right now, because I am concerned if we're going to reach those same levels. I think it's not clear exactly when those hospitalizations will flatten out. We do not see a flattening that I've seen as of yet. So I will be watching that very, very carefully.
What steps can the state take to ease the strain on hospital staff if hospitalizations continue to rise?
I'm sorry, could you repeat? I couldn't hear.
What steps can the state take to ease the strain on hospital staff if those numbers continue to rise?
So we'll have to continue working with our hospital partners, because there are a number of things that can be done at each individual hospital. So for example, if telemedicine type services are utilized, okay, as an example. Different things that can be done to consolidate services and be able to really optimize the care of patients that are in the hospital. And those are conversations that we have regularly with the CEOs throughout the state. And we're going to have to watch this very, very carefully, because different hospitals are going to be experiencing pressures potentially at different times. And the story at one hospital may not be exactly the same story at another hospital. But that's just a few examples of the way that we're going to have to continue to monitor things.
All right, thank you.
Governor Thornhill.
How about last question right here?
I'm sorry, I couldn't hear that completely. Positivity rate? Yeah, 21.5% is where we are in terms of PCR positivity rate in the state right now.
Should there be a statewide mask mandate at this point?
Governor, would you want to answer that?
Sure.
I don't think so. I think overwhelmingly people of Connecticut are doing the right thing. They're wearing the mask. I don't want to put a lot of counter pressures on and rebellion and people fighting back against it. I encourage everybody, wear the mask when you're indoors. I'm getting N95 masks available to anybody, so no questions asked. I think we're on the right track right now. Thanks, everybody.